Hi guys, what's up? Welcome back again. Today I'm gonna talk to you about hand and wrist examination. So let's start. Okay guys, we'll start with the examination, but before that you have to say that about the state of the patient. What does it mean? It mean is it he or she is fully conscious or not? Okay, obese or underweight, anemic or not, is in shortness of breath or not, he's quite comfortable or not, he is a cooperative patient or not, he is in distress or not. Okay, all of them. And then we are gonna do this theorem in any examination. We have to start with this one, which, okay, which W for wash your hands, I introduce yourself, T for take a permission from the patient, E for explain what you're gonna do for the patient, and SH for shaking the patient's hand. And then we are gonna inspection, palpation, percussion, and auscultation. But here in hand and wrist examination, we are gonna examine the patient with inspection and palpation, no percussion and auscultation. So let's start with the inspection. In inspection, in general, we are looking for color of the skin, scars, deformities, nail changes, muscle wasting, swelling, cannula, and tremors. Okay, according to this theorem, color of the skin, we have you have to mention is it peripheral cyanosis present or not. Okay, because there are a lot of causes. One of them is a cold exposure and decreased cardiac output, and the second one is it pale or not. Okay, in anemic patient or in emotional state or in a shock also it's present, and in tap staining, in tobacco staining, what we call in smokers. Okay, and then we are gonna scars. Okay, scars, is it present or not? If it's present, is it a new one or old one? Appearance of the scar is very important. You have to mention and the site of the scar also. And then we have deformities. Is there any deformity or not? You have to mention, for example, when we have Dupuytren's contracture is one of the deformities in the joints. Is there many causes? One of them is in chronic liver disease, you will face it, and the diabetes patient also, and heavy alcoholic consumption. In this 3-1, for example, which I mentioned it, you will face it: chronic liver disease, diabetes mellitus, heavy alcoholic consumption. Okay, and then we have nail change is very important to note any defect or any deformity of the nail shape, color. Okay, for example, you have to mention, is it the first one, is it clubbing? Okay, clubbing is present or not. Okay, the second one is koilonychia, the third one is leukonychia, the fourth one is splinter hemorrhage, the fifth one is destructed nail. Okay, according to this term clubbing, okay, there are a lot of causes. Cardiovascular causes, we have clubbing. Okay, we have cardiovascular. Okay, cardiovascular, respiratory, we call okay, or this one, respiratory, cardiac, and the third one is GIT. Okay, GIT cause. We have cardiovascular causes, respiratory causes, and GIT causes. Cardiovascular causes, all cyanotic congenital heart disease causes clubbing. Okay, and according respiratory, we have bronchiectasis. Okay, lung cancer, fibrous alveolatus bronchogenic carcinoma also. And according GIT causes of clubbing, we have liver cirrhosis, inflammatory bowel disease, and celiac disease also. This about clubbing. And Koilonychia also what we call a spoon shape. It looks like a spoon. It's usually due to iron deficiency anemia, and leukonychia, its appearance, white appearance in color. And then a splinter hemorrhage usually seen in cardiogenic cause, also destructive nail also. And then we are looking for muscle wasting. Swelling is very important to detect the site of the swelling, shapy, and is it hot or not, temperature and tenderness, I mean. And then we are gonna to cannula, is it present, okay? If it is present, is it in the right hand or in the left? And the color of the cannula is also important. And is it connected to the IV fluid or not? You have to mention the name of the IV fluid also. And then we have tremors. In the tremors, we have fine and flapping tremor, okay? Fine tremor, let's write down, fine tremors and flapping tremors. Okay. In fine tremors, there are a lot of causes. One of them is in a case of hyperthyroidism, toxic goiter, okay? And stress also, and anxiety. And a patient with beta-2 agonist use salbutamol also, you will face this one. Fine tremor. And flapping tremor, in the flapping tremor, for example, you will face in the case of hepatic encephalopathy, liver failure, okay, and uremia also. This is according the state of the patient or the disease which the patient got it, okay? And then we have to ask the patient to lift his or her arms up and show as his or her elbows, okay, to detect psoriatic plaque is present or not, and a rheumatoid nodule also. Is it present or not? This is about inspection in general of the hands. Okay, now let's start to palpation of the hand, okay? You have, which is the second step of the examination, is a palpation, which you have to assess temperature, I mean both hand, okay? Because in any examination, you have to compare both sides, in inspection, palpation also, okay? And then temperature, joint pain also, and we ask the patient to tell us if when I'm gonna touch his or her hand, he or she feels pain, okay? Or tenderness also. Muscle wasting, cold or hot, more or less related to thyroid, and sweaty or dry. Okay, and then we are gonna palpate a radial pulse. As you know, the normal range is 12 to 20 beat per minute, or we can say 80 plus minus 2, okay? And the volume of the radial pulse also is very important. You have to mention it. For example, if it is a bounding pulse related to heart palpitation, of its threatic pulse related to hemorrhage or shock also. And ask the patient to turn them over for us. I mean his or her hands like this, for example, and ask the patient to turn like this, okay? Assess the thenar and hypothenar muscle bulk, and assess for palmar thickening. I mean dupuytren contraction, for example. Causes are, as I said, chronic liver disease, diabetes mellitus patient, and heavy alcohol consumption. And then assess sensation of the hand, I mean, ask to the patient to close his eyes and gonna touch hands very gently, and ask a patient to say yes when you feel it, okay? You're gonna touch thinner for median nerve and hypothinner for ulnar, and ask patient to turn them like this for us and gonna touch here, okay, like this for radial nerve. And then we have assess and compare joint temperature, and then squeeze metapharyngeal joint. I mean, just gonna press or squeeze metapharyngeal joint, observe for signs of discomfort, okay? And then by manual palpate the joints of the hands, not any tenderness, asymmetry. I mean, metapharyngeal joint, proximal interpharyngeal joint, distal interpharyngeal joint, okay? And then by manual palpate the joint, I mean wrist joint, okay, not any tenderness and asymmetry. Then palpate the anatomical snap box, okay. This is for if it's tenderness, for example, may suggest scaphoid fracture, okay. And palpate the ulnar border of each arms to the elbow. This is for not any rheumatoid nodule or psoriatic plaque, okay. And then we are gonna finger extension and flexion, wrist extension and wrist flexion also, and passive wrist flexion and extension. This is for feel from crepitus if it's present, okay. At the end, please never ever don't forget that to thank a patient to more or less cooperative with you in the examination. Thank you for watching this video. This is all about examination of hand, which include inspection and palpation. I hope you got a benefit from this video. Thank you for watching. Don't forget to make dua for me. Thanks.